Prior to my diagnosis, I was a single mother, the youngest of 9 children. Just a, everyday single mom doing what she has to do to make sure everything gets done.
I was actually working in the pastry kitchen at the Park Hyatt in Chicago. I had gone to culinary school after I lost both my parents to cancer, and so I wanted to figure out what I wanted to do with my life, and so I went with my passion, and that's cooking.
I was just a mom busy with 2 toddlers, working and married and trying to just balance work, life, kids, all of that.
I was a woman of faith, a wife, a mother of 1 child, very active, probably overworked. I was exhausted somewhat.
Breast cancer disparities between Black women and white women in particular have been pretty pronounced for decades now. What we know is that in general, when there's any kind of innovation, new technologies, new treatments, new medicines that come out, those who have more social capital, more financial resources, better insurance, have more access to these things.
My diagnosis, it was along my collarbone. I didn't know that. I didn't know cancer could come there. I'm thinking, oh, that's my shoulder. That's me carrying heavy bags all the time. They didn't see anything. They were going to send me away. I said, wait a minute. You can feel it. You can see it protruding from the surface of my skin. And so they dug in deeper.
At the time that I was diagnosed, I had no symptoms, nothing whatsoever. They told me everything was fine. They were like, you're perfectly healthy. You're not in that age range where you need to have regular mammograms, so you're worried about nothing. Go ahead, live your life, enjoy. And so I went back to work, and I got a call from the chief radiologist, and she said that she had taken a look at my films while she was on lunch, and she saw something right at the edge of the film that didn't look quite right to her.
If we're going to our hospitals in our community, they do not have the high-level, high-functional, the latest state-of-the-art mammogram for our testing. It doesn't show up on the outdated equipment.
Breast cancer is just a classic example where there's just a lining of many factors which contribute to widened disparities.
In 2006 is when I discovered a lump in my breast and went through all of the diagnostic process to understand that I did have cancer. Then it was a point of needing the insurance approvals for the next journey. I had to get a chest CT, an abdomen CT, a pelvic CT, a bone scan, different tests that had to be done before I could actually see the oncologist. And so getting those approvals was, to me, in my mind, an emotional barrier, knowing that these are things that I need, but you have to tell me that I have to have your permission to do so.
I am one of 3 sisters, and all 3 of us were diagnosed with breast cancer. Myself and my older sister were diagnosed about 6 months apart. My middle sister was diagnosed probably maybe 2 years after. And when she was diagnosed, unfortunately, she did not have the level of health care that my older sister and I had. And it was a fight to try to get her to be able to switch from the hospital that she was at. Fight with her insurance company to the point where her oncologist or her primary physician said, actually, it's all about money for them. They don't really care. They're not going to let her switch over.
There are a lot of structural inequities that contribute to breast cancer disparities, but some of them are also having to do with us as a community and the fear and distrust that we have of the medical institutions, a well-earned fear and distrust.
I think back to when my mother was diagnosed with breast cancer, and I went to see her physician with my aunt because we were just trying to get a better understanding of her care. And this was a white male physician And he responded in a way that blew my mind. He said, I can't even remember what question we asked him, but his response was, your mother has metastatic breast cancer. She's going to die. There's absolutely no reason a physician should say that to anyone.
I had the mastectomy, I had 6 rounds of chemotherapy, I had radiation, I did Zoladex and tamoxifen for 5 years, and after 5 years they said, okay, you're considered clear. And so I went on living my life thinking, you know, that's behind me, moving on. And so around 2017, I started having pains in my hips and my back. Still, I'm being told by doctors, nope, you just need to stretch, everything's fine. No one ever took into account that this woman has a history of breast cancer. It metastasizes to bone cancer. Maybe let's check that out. No one ever said that. When I talk to doctors, they'll say, oh, you're an oddity in that your cancer was dormant from 2005 to 2017. And I disagree and say it wasn't dormant, because when you found it in 2017, there wasn't a spot on my thigh or a spot on my rib. There was cancer everywhere, all over my body. There's still so much unknown about cancer that I don't think any patient, especially when it has been invasive, should be left unmonitored for that period of time. They didn't follow up on me. And had they done that, you know, maybe it wouldn't have spread to my liver where it is now.
My role as a physician is to make it easy for people when they come into the healthcare system to feel loved and cared for and safe, so that when they come in, they know that they are not going to be harmed, that I'm going to do the best I can to advocate for them, that they'll be protected. Part of the challenge that we have as we're fighting this fight against disparities is more physicians, more nurses, more mammogram technicians who look like me, because that is going to provide a sense of safety and emotional comfort for people to be able to enter spaces that have previously may have felt unsafe.
This is my daughter, Brittany, and my grandson, Aiden. All of my strength comes from these two.
Okay, I can answer that. Us.
Yes, I'm in the fight for the long haul, but whenever that time comes, I want there to be memories that both of them have that they can reflect on, and have those to cherish and remember, you know, our time together. I have friends that I've been friends with since kindergarten. I have friends that we're friends since high school. I met Desiree probably around 2013. She takes me to all of my chemo appointments. She sits there with me, takes her laptop, she gets her little desk. All the nurses know her. They bring her snacks. Angie in the red, she's also a newer friend that came along. She bought all of his uniforms, my grandson's uniforms, when he was starting school and I was in the hospital trying to get the condo ready for them to move into. She drove me around to stores to get things that I needed for the condo. I think that's Reese in the back there. She was here one day cooking. She was making greens, had everybody in the house asking, where's that lady that was making those greens? So these ladies, this is just a small sampling of the support system that I have.
My coworkers were very supportive. I also had the support of my family, of my friends. My church family, of course, was there for me. They were praying for me. My pastor, Apostle C.L. White Jr., he was a guiding light for me as well. But everyone that I had in my life, they supported me through that journey.
When I was going through treatment, though, I didn't feel like I needed necessarily a support group. I probably did. but there weren't very many support groups available at the time that I could really reach out to for that kind of emotional support. But my community really rallied around in terms of, bringing in food and offering to take the kids and just trying to do things to kind of keep my mind off of what was going on.
When she got cancer, like I said, I didn't even know what it was. But like now that I know what it is, I feel bad, like, cause she's sometimes tired. And like, she don't have anybody else to help besides me and my mom, so that's like.
I've had several friends, unfortunately, who have lost their mother to cancer. And like my most recent friend, her mom recently passed, I wanna say last year, of breast cancer. I'll never forget one time we were at a party. And going out is kind of like my outlet to just be free, not think about anything, and we were out and she was just having a meltdown in the bathroom, calling on me. And she was like, how do you do it? Like, how do you stay strong? And I'm like, not at the party, I don't want to think. But it's like, I felt bad the next day because it was like she needed that support, You definitely need support to get through it and find your outlet, something that brings you peace. It could be, I don't know, taking a walk or anything. Just find an outlet where you can rest your mind and kind of just let all your thoughts just go.
This space here is, I call it my Zen room.
A lot of people do it alone. You'd be surprised. A lot of people don't share. A lot of people have broken relationships with their families. You don't have to go through cancer alone, and really advocating and sharing with people that there's help and there's support out there. I had to go outside of the community. I live in the city. I had to go to the suburbs where they have resources there. I did find a couple of support groups, but I found them to be more just social, like a social club. And for me, going through treatment and what I was going through, I needed resources. I needed connections with what I can do to beat cancer. So everything that I didn't have, I created it.
I was very angry with the treatment that my sister received when she was going through breast cancer. I mean, I was really, really angry, and I just happened to share that with a nurse friend of mine who works in the breast cancer space, and she mentioned, you really need to get out there and just tell your story and the story of your family.
Sharing stories gives people hope. It allows people to see that if she survived, I can survive. And just being able to tell our stories is an opportunity for us to continue that healing journey, that processing it all.
Unfortunately, women of color don't always get access to the resources that are out there and available. And it's like a secret, like a secret society, like you have to navigate and hunt and find. And some people aren't successful with finding that information. So if I can, through sharing my story, my experience, if I can garner some light or provide some insight to someone else to make their journey with dealing with this disease better, it's just the thing to do.
Even in the journey that I was on, I did a lot of networking. I went to Washington, D.C. I went to Springfield to advocate for legislation and for research and for funding dollars. And not seeing as many African-American people involved in that process, I wanted to make sure that African-American women were able to use their lived experience for good and to help others who will be diagnosed with cancer as well.
I'm not big on public speaking, but I do feel passionate enough that I'm willing to get over that fear of speaking in public to be able to impact somebody else. Every time I go out and do an event, that is my prayer before I get out of the car, is let me just impact one person.
There is a scripture that I hold true to my heart that states that my people die from lack of knowledge. We grew up in a culture, even from our parents, it's like, what goes on in this house stays in this house. We carry that with us, We are just As I can say, suppressing that, depressing those feelings, the things that are going on in our life, and we're not sharing what we're going through, how can we help? How can people help us? How can we know what worked and what didn't work? We have to share our stories.
It's also going to be really important that we have people who are in the community health workers, that are working alongside people in the hospital, but out in community spaces to talk to our neighbors, our friends, our loved ones who are not in healthcare spaces, but are just out and about living their lives, to let them know that prevention is just as important as treatment, that we want to find things before they find you. And that's what Sisters Working It Out is about. One of the things that is important nationally that we're beginning to understand is addressing what we call social care. And that is the kind of unmet needs that people often prioritize before their health care. So that is food, transportation, housing, and those things that can get in the way of addressing your medical needs first.
Every individual comes from a family. Every family lives in a community. And so we outreach to the individual to get connected with the family that lives in the community. It is a holistic approach to wellness, taking in consideration the physical body, the mental wellness, as well as the spiritual wellness. We need all three.
I want Black women to understand that health is wealth. We should be very proactive and just staying on top of all of our screenings, our breast screenings, our cervical screenings, our overall health, and be beyond that diagnosis.
We want to, live healthy. We want to eat right. We want to exercise. We want to do preventive care. And so having people all along the spectrum that can wrap our hands and arms around Black people and just love us, tell us about the best ways that we can be healthy is a critically important part of the equation for addressing health disparities.
I've also, learned the importance of exercise at the very least. That's the thing that I could do to help my own physical outlook. And then I've also learned again about stress and not letting things bother me, not letting events or outside things take me to a level where I'm just really in a bad place emotionally.
Stress is not good for cancer patients. So I take things a lot less serious now.
After being diagnosed with triple-negative breast cancer and having a testimony afterwards, it has really transformed me. Now I am more open. I feel that I've bloomed as a flower. It's really taken a look at slowing down.
Try not to focus on the diagnosis itself. Be patient, be aware, be diligent.
Be encouraged.
Yeah, be encouraged, have faith. Find your faith in something. If it's not with God, find something that encourages you. Find something that motivates you to want to fight. Don't give up. When the doctor told me in 2017 that, a hospice was the next step for me. My mother wasn't in the room when the doctor said that, but she came in the room and I was crying and everyone in the room was crying. And my mother's like, "Why are y'all crying?" And I said, "Well, she just said hospice is the next step for me." With the doctor there, she looked at her and she was like, "She don't know what she's talking about. God has the last say so. God is in control. And you're not going anywhere until God says it's your time to go." And she was right, because that was 2017 and I'm still here.
We've already seen a significant decrease in the Black-white mortality gap for breast cancer here in Chicago by increasing the access of all women, including Black women, to high-quality breast cancer screening, high quality breast cancer diagnostic evaluation and to high quality treatment. Everything we do is a community effort. We don't have the privilege of thinking that anything that we do is just for ourselves. And so everything that we think about, everything that we strive for, we have to think about that we're doing for the greater good of the rest of us.
When I look at this and relate it to my journey, really the first thing that comes to my mind is this girl is on fire. That's what comes to my mind. And that's how I feel. Confident, determined, nothing's gonna stop me as long as I have faith and fear is not an option. I'm unstoppable.
She's totally open. She's giving. She has nothing to hide. She's ready to either transform or to give birth to something.
I see a woman who is in a posture of praise, in a posture of worship. Reminds me of my crying out to God for healing, for deliverance, for saving me.
You can survive this disease. Be your own advocate. Look for the best treatment. That may be a clinical trial, it may not be, but you can survive this disease. I'm 20 years out of my first diagnosis.
My name is Angela Waller. I'm an 18-year survivor of triple-negative breast cancer and founder and CEO of Elevated Survivorship.
I'm Del Cain, founder and executive director of Advocates for Community Wellness. I am a triple-negative breast cancer survivor. It has been 9 years since my diagnosis.
I'm Alicia Cook, and I am a 2-time breast cancer survivor, and I want to make sure that the community knows this is a disease that you can survive.
My name's Yvette Saunders. I have been battling since 2001, and I'm still here, and I don't take that for granted.
Everyone's story is part of who we are.